I am Vito Gearity, the Programs Manager here at NHMA, and it is my pleasure to be your moderator for the amazing panelists that we have today for our Instagram Live on Facing Flu in the Times of COVID-19. So without further ado, I will introduce our speakers, and then I'll have everyone give a quick background on who you are, and we will go from there and answer some questions. So first off, I would like to introduce Dr. Elon Shapiro, Medical Director of Health, Education, and Wellness at AltaMed, and he is also a NHMA chapter leader, and we're very, very happy to have him on board with us. We appreciate you, Dr. Shaps, so thank you for being here today. We also have Dr. Michael Greenberg, the Vice President, Regional Medical Head of North America at Sanofi Pasteur. Thank you very much for being with us today.
Great to be here.
And we also have Councilmember Oscar Delgado for the city of Reno, Nevada. And I believe we may also be, we might also have Mayor Schieve join us as well. So thank you all. And Dr. Shaps, if you would like to give a quick background on yourself, and then I'll call on the other panelists as well, and then we'll get going.
Perfect. Well, nice to be with all of you. It's I'm come from a small city called Mexico City. I'm a practicing pediatrician here in the area of Los Angeles, and I'm the medical director for Africa Qualified Health Center, and I'm the medical director for Health, Education, and Wellness. And prevention is my game, making sure that our new generation kids, family members, avoid suffering. That's something of the most important things that we have, and it's a pleasure to be here with you.
Thank you, Dr. Shaps. And Dr. Michael Greenberg.
Hi, it's great to be here with everybody. My name is Michael Greenberg. As you heard, I'm the medical head for Sanofi Pasteur for North America, or the vaccines division of Sanofi. I'm a pediatrician by training. I actually practice out in California, up in Northern California in Redwood City. So I'll give a big shout out to Fair Oaks Family Health Center, where I had the pleasure of practicing for a number of years, and I'm really looking forward to for this chat.
Excellent. Thank you for being with us. And we also have Councilmember Oscar Delgado.
Hi, good afternoon, everybody. I hope is that Mayor Schieve would be joining us here shortly. As a mayor, of course, she's tremendously busy and always being pulled in every single way. But again, my name is Oscar Delgado, Reno City Council for the District of Ward 3. I'm also CEO of Community Health Alliance, which is an F2HC here in Washoe County. In addition to that, I'm a current chair of the Washoe County Health District here in Washoe. So all healthcare, all the time, but excited to be part of the panel. Thank you for having me.
We love it. We love it. Thank you so much, everybody, for being with us today. And with that being said, we can jump right into it. Why not? So I would like to kick it off with Dr. Shapiro. Let's talk about the general importance of the flu vaccination.
First of all, I'm so sorry for everybody that is hearing us. I hate when we tell the flu. Is it the runny nose flu? Is it the stomach flu? Then I'm going to clarify what do we need and what do we mean with this. We are talking about influenza virus. It's a very, very nasty virus that was one of the worst killers that we had before COVID-19. And you probably have heard about the Spanish flu. That's actually was influenza virus in the early 20th century. Then we know that they are bad, they're horrible, and we had our very close encounter in 2009 with the H1N1. And we know that this is not a simple cold. It's not like I have the sniffles, I have, no. This is a week of suffering, and a lot of people actually end up having a lot of pneumonias, and kids, specifically elderly and people with chronic diseases, can have a higher mortality rate. I'm not talking about a simple cold. We all, sadly, will have 4 to 6 colds a year, and it is what it is. But on the other side, we have this virus that actually is a killer and something that actually complicates a lot of the things in our community.
Thank you. And that being said, who should get vaccinated? Anyone in particular? Everyone? What do we think?
I never do this in public, but anything that it's a human being above 6 months of age can actually get protected against influenza. We have amazing vaccines that will protect you and decreases the opportunity of you ending up on the hospital, you ending up with complications, and most important, you and your family of actually ending up with, mortality rates, with dying.
Exactly, right. And you did mention before, it's not just the normal cold, and you touched on those complications. Can you go a little bit into more about those risks that are associated with the influenza that, most people think, oh, it won't happen to me?
We all feel that if we're vegan, organic, vegetarian, and actually doing sports, the virus will go like, oh, no, he smells like vegetables. Oh, no, he's waiting. No. And the virus jump and move to another place, but in reality, it's by the contrary. This virus, if they smell human, they attack human, and they only speak human, then that's the thing we need to know, that the complications are real. It goes from just 1 week without going to school or work and stuff like that, and high fever is getting horrible, and you can start having pneumonias and other infections that just make you feel horrible. And a lot of people, by the way, ask me I get the flu shot. I go again with my spiel. It's the influenza virus vaccine, because we need to be very clear. It's not going to cover against every known cold to humankind. Sadly, we do not have a vaccine like that, but it will for sure help you a lot against COVID-19, against influenza, and that actually will help you a lot.
Right. That actually brings me to my next question, Dr. Greenberg. So with that being said on those risks, what about those risks being compounded with COVID-19 that we have now?
Well, I think, a lot of people who are at risk of the severe complications of COVID-19 are in the same groups, like Dr. Shapiro said, are in increased risk of complications of flu. So, for example, if you're overweight, if you have diabetes or underlying heart disease or lung disease, you're at a higher risk of complications, not only for COVID-19, but also flu. We even know that if you've got diabetes and you get the flu, the influenza, it can actually make your diabetes worse. One thing that a lot of people don't realize also, like we're seeing with COVID-19, which can affect really just about any system, any organ in your body, whether it's your heart, your lungs, your sense of smell. Well, with flu, it also can affect a lot of different organ systems. So we know that if you have underlying heart disease and you get influenza, you can have up to an 8 times increased risk of a heart attack within a year. We also know that there's increased risk of stroke. And if you're older and independent, you get hospitalized for influenza with flu, you're actually about 15% more likely not to be able to go back to the same kind of independent living and mobility status that you had before. So it really can affect just about anything in the body. So when we protect ourselves with a flu vaccine, we're protecting more than just for flu. We're really protecting beyond it. We're protecting for all the different complications that flu can cause.
Wow. Yeah, that's a great point. I'm sitting here learning as well. I'm sure not many people think about all of that. So that was a great point. So thank you for letting us know that. And also, I did want to touch on the co-administration of the flu and COVID-19 vaccines.
Yeah, so co-administration is when you give 2 vaccines at the same time, and the CDC has come out very clearly to say that you absolutely can get both vaccines at the same time during the same medical visit. So we want to make sure, for example, whether it's your first vaccination, your primary vaccination series with a COVID-19 vaccine, or if you're one of the groups that's been recommended to get a booster dose, you absolutely can get the COVID-19 vaccine and the flu vaccine at the same time. In fact, you can actually get, CDC has said you can get any routine vaccine as well at the same time as COVID-19. And maybe just the one thing, we're really excited. We just finished a clinical trial with our high-dose flu vaccine, which is for individuals who are over the age of 65, where we gave it to people with the Moderna COVID-19 vaccine and showed that both vaccines are safe and as effective as when they're given separately. So really reassuring, but absolutely you can get both at the same time.
Yeah, that's great stuff. And it's really amazing that we have this now. So I want to go over to Councilmember Delgado. Wanted to ask you a question here. Why, as a city leader, are you encouraging flu shots and making the influenza vaccination a priority?
It's it's imperative, especially now as we're still in a pandemic. I took my mask off briefly until the mayor shows up here. I'll put it back on. But the big part is just making sure that the community is aware that the importance of it. I mean, one of the big things we're seeing here in Washoe County is still the high rates of ICU beds that are being utilized by the pandemic. One of the big things we want to make sure is that we keep those beds there for those cases. One of the ways you can do that is making sure you get the vaccine, the flu vaccine, so that you're healthy and you stay, and we keep that infrastructure available for those that are most compromised in our community. The other one too is we know from a macro sense is the impact it has on our economy. We saw what happened with the pandemic, but to layer that with some more issues, it is imperative that we keep our businesses going, our economy safe, and those that work in those businesses safe and healthy. We also know that our little ones, our kids, if they're not healthy, then they don't go to school and they don't learn. And we already know, especially in our most vulnerable communities, that just layers on, keeping them back further from continuing to be as successful as they can in our educational system. So it's an ongoing piece, but the bigger part of a lot of this is breaking through some of that hesitancy, breaking through some of that misinformation, that miscommunication that's spreading throughout social media and those platforms. You know, there isn't a day where I don't go to the grocery store, I go put in some gas in my car that I run into a neighbor or a family that's still believing that there's something to deal with this vaccine and why are we doing it to our people. And my simplest reply is because we want to keep them safe. It's our job, especially in these positions in leadership, to make sure we're saying the truth. And the truth is, you know, get the flu vaccine, get the COVID vaccine. Let's keep each other safe. Let's keep our community safe. Let's move forward. Let's get out of this pandemic. And let's do it, if not for yourself, then for your families, your loved ones, for your primos, your abuelitos, you know, for everybody. We got to make it happen. And that's why I'm taking a huge piece and making sure that I'm saying go get it.
Absolutely. Yeah. I like how you mentioned the children. Again, like Dr. Shapiro said, it's not just a cold. You know, sometimes it can be, and that's great, but other times there are serious complications. And we know, we heard firsthand, want to shout out Families Fighting Flu. There's, you know, a lot of people out there that unfortunately it wasn't just a cold. So thank you for touching on that aspect as well. But I also wanted to get into some of the rates in the flu vaccination coverage rates in your county and region.
You know, what we've been seeing over the last few years, in 2018, there was about 36%, in 2019, about 40%. As I think we continue to make sure we communicate, and thank you for doing this panel, is really communicating to the communities that we serve. Here in Washoe County, we're now about 27% Latino and growing. So it's immediate and important that we continue to make sure we can communicate with those surrounding communities, especially in the bilingual platforms, and especially through these platforms, to say what is true and what is not true, and to talk about, again, the misrepresentation or miscommunication with respect to what's a flu vaccine and what's a COVID vaccine. And so ways to make sure we drive those rates up from 40% to more and more every year. So making sure we have these platforms available, we could have these candid conversations and talk to all of our loved ones and our families in these ways. And so, again, as the chairman of the Washoe County Health District, that's something that we take very personal, and we have outreach teams out there. We're closely communicating with the city of Reno, City of Sparks, our joining partners, to say, how do we get those vaccines available and increase those rates? And so even our fire department's going out there and doing mobile clinics, where we're taking them to our senior homes, we're taking them to our events out in the streets. We're making sure that they're accessible, available. It's not a hindrance to go and find it and get it. And for those that are watching, please go to immunizednevada.org. Please go to the Washoe County Health District website. That's where you'll find information as to where to go and get a free flu vaccine and also a free COVID-19 vaccine.
Yeah, so you did just touch on this briefly, but I'm sure there are some specific Reno residents here watching us today. Where can they go specifically, you know, in that area to get their vaccine?
Yeah, absolutely. Go to immunizednevada.org. They'll have a list of basically a hub of information here in Nevada. In addition to that, they could go to the Washoe County Health District, or they'll be able to tap in and see where those are available and free. And also our FQHCs here, which is a federally qualified health center, Community Health Alliance, Northern Nevada host, where they can go and get, again, free vaccines. Those are available to everybody in our community, no matter your status. That should not be a question or a hindrance. Again, that's where we got to keep everybody safe. In addition to the flu vaccine, if you haven't gotten the COVID, that's an opportunity to get your COVID vaccine as well.
Excellent. Thank you. Great information for Reno residents there and everyone in the country. Thank you. So, Dr. Greenberg, I'll pose this to you first. Let's get into the specifics here. How do flu vaccines actually work?
Yeah, great question. So flu vaccines work like a lot of the other vaccines you may be familiar with. So really, for the most part, they use an inactivated form of the virus. There is one live flu vaccine, but for the most part, most of them are inactivated. And what they do is they work by training your body's immune system. So what's your immune system? Your immune system is like your army, right? So when you give the inactivated vaccine, it's kind of like showing your immune system, showing your army. It's like if you see something that looks like this, go out and attack it. So we don't give the actual infection, but we give something that looks just like it, so that when your body does see that infection, that all those cells in your immune system are already revved up. They know what they're looking for, and they go in and they attack it.
Right, right. And Dr. Shapiro, anything to add there, or maybe even go into, combating the myths that we have been seeing everywhere?
Familia, if you already heard this, with the vaccine that is injected, it's not a live virus. We just give enough information to our body to react, understand, and create antibodies that they are kind of the laser missiles that we throw out to protect ourselves. You're not here for these two doctors that we're not saying that you will get sick, because a lot of people go like, Doc, well, I never take it and I never get sick, and one day, and we start doing that part. And I need to remind everybody, and I need to remind myself, we start vaccinated in the time of the year that it's cold. And it's getting cold. And as humans, we have, the good news is we do have enough, we have a beautiful vaccine against influenza, but there's like more than 35 other viruses that we do not have, some type of vaccine against it. Then if you get the influenza vaccine, that's why I don't call it the flu. The influenza vaccine, you're protected against the complication. We'd love to promise you that we have an amazing 100% vaccine that is amazing, and sadly, we do not have anything like that in medicine. That's why it's so important to be clear. And this kind of, when we go to the car, Vito, and we use a seatbelt. We always have the choice not to wear a seatbelt, right? Is it good, legal, or whatever? We can talk about that part. But if you have an accident and you're not wearing that seatbelt, you're probably going to fly away or have a horrible complication of it. But if you have a seatbelt, and that's our vaccine against influenza, you will talk to me afterwards. You go, yeah, I got a little bit sick and stuff like that, but I'm here, I'm talking to you. I don't have all these complications that I could have if I was not wearing that seatbelt, that vaccine.
That's a great analogy, Dr. Shapiro. I love that. That's excellent. I'm going to say that to everyone that I come in contact with. And I also did see Mayor Schieve join us. Hello. Say hi to the people.
Hi, everyone. Nice to see you. I'm grateful to be here. I'm Reno Mayor Hillary Schieve. I'm here with a tremendous friend of mine, Councilman Delgado, and massive health advocate here at the city of Reno. Blessed to have him. Great to be with you guys. I would just say, one of the reasons why I got vaccinated, what was so important to me, I have people in my life that I love so, so much. And if something happens to me, I'm sort of the caretaker, right? Like, they rely on my job to put housing and food on the table, right? So if something happens to me, I don't know what would happen to them. And so that's why it's really important that we all get vaccinated. I can't stress that enough. If you love someone that much, protect them that much.
Absolutely. Thank you. Thank you so much for that message. It's came at a perfect time here. Councilmember Delgado, any other last words here?
The mayor said it all right. When it comes down to the bottom line is protect yourselves, and if not for yourself, and for those around you. Be considerate, be responsible, be respectful. If anything, what the pandemic has shown us is that we're all in this together, and the more we take care of each other, we're all vaccinated, and we look for the future, the quicker we'll get out of it, and the healthier we'll be for it. And again, it takes leaders like Mayor Schieve that's going to be willing to put themselves out there and say, this is what we got to do during this kind of really tension in our community. in our country to take leadership, to stand up and say, this is the right thing to do, this is what we had to do, and this is how we're going to get out of it together.
Thank you. Thank you. I think we covered a lot of great stuff in a pretty short amount of time, which is great. But Dr. Greenberg, any last words?
Well, I would just say, flu really doesn't care, what color your skin is, what language you speak, it can affect anybody. And we've got, vaccines that are our best way to protect. And so it's really one of those things, we're our hospitals and our clinics are all filled up with people who are dealing with COVID-19. The last thing we can afford right now is to fill up those same hospitals and clinics with people who are coming in with flu, which we can prevent with vaccination. So again, really important this fall, get your flu vaccine and everything else you can do to try to stay healthy.
Excellent. Thank you. And Dr. Shapiro?
Familia, we are always trying to do the best things for our community and for our family, and everything starts with us. A lot of people go like, well, I have never gotten sick, but I do start the conversation. Would you afford not to be working for a week? Would you be, what would happen with your family if you end up in the hospital? Who's going to provide for them? Or the other way around, when you have kids, if you are the one that is out there and bringing, influenza to them, and you have a newborn, or you have someone that has disabilities, issues, other stuff, then we need to think about everybody. Then your actions are very important to yourself, but what happened with everybody else around you if you're missing, you're sick, or you're in the hospital? And that's why I always get my influenza virus vaccine. And I do the same thing with my kids, my family, my mom. And they know already, like Dad, it's getting cold when I'm going to get my shot. And it's part of the stuff. Of course, I promise you, they do not like the needle, but they like the feeling of being protected. They love it.
Awesome. Thank you. We do have a few minutes here, and I did catch some questions. Actually, got a decent amount of questions that were coming up in the chat. If you all would like to address some of them, I have a good one here. When is the flu season, and what is the best time to get the shot? Is there a golden, time period, or if anyone would like to speak on that?
My colleague that is on that corner, I don't know if everyone's having the same thing.
Dr. Greenberg?
Yeah, sure. Well, really, so as Dr. Shapiro said, it's fall. This is really the time to get your flu vaccine. We want to make sure you don't get it too early. So if it's August, we're not in August anymore. So it's, that's a bit too early. But really, any time is the right time to get the flu vaccine. But really, usually we say, ideally by the end of October. But you can get your flu vaccine anytime as long as flu is circulating. So even into December, January, if you haven't had it.
Great. Thank you. And let me see. I have another question. What can non-doctors do to help make vaccines more accessible? It's a tough one.
I promise you right now, I think that as doctors, promotores, nurses, I think that right now the thing that we need to do is talk with the terms and make sure that we talk about the influenza virus vaccine, because a lot of people are afraid that they will get the flu or the cold or whatever. And this is way above that. It's a virus that kills people, that harms a lot of people. And we need to talk about with the term that it's influenza virus. And we need to start doing, because, and we have seen it right now with COVID-19, we need to have straightforward conversations. And trust me, Vito, they don't send me little stars or flowers every time that I vaccinate someone. But I do feel better when everybody has the choice and opportunity to do the best things for them and their families. And I do believe that vaccines, especially the influenza virus vaccine right now in this season, is extremely important. We have been talking about that twindemic, having influenza and COVID-19 joining partnerships and actually destroying communities. And the only way that we are going to start avoiding that, and that part of it, is that it come back. And we're going to decrease the possibility of the virus jumping from one person to another. And it opens a lot of conversations. And we need to be honest. And there will be people that will be afraid, and that's okay. There will be people that will ask you for side effects. Well, redness, pain, and you're going to be feeling iffy. But remember, it doesn't have the virus inside of this shots that we're injecting. Then it's very important to have all those honest conversations.
Absolutely. Thank you, Dr. Shapiro. All right, so I think that was all the questions that we have so far. I really appreciate all of you taking the time to join us today. This will certainly not be our only Instagram Live, so please stay tuned. I also wanted to thank Sanofi, the National Forum, and Families Fighting Flu for their support, and Move with the Mayor as well, everyone for their support to make this very successful and very informative. It was great to have you all. It was my pleasure, and we will see all of you next time.
Thanks, everybody.
Stay
Thank
safe.
you.
Stay safe. Get your vaccine.
Hashtag Mayor made me do it. Get the vaccine.
Thank you.